Good morning, everyone. Good morning, Professor Chua Hong Chun, the Chief Executive Officer, Yishun Health, and the Deputy CEO, Clinical at the National Healthcare Group. Adjunct Associate Professor Yip Chi Chu, Senior Consultant and Head of Department of Ophthalmology and Visual Sciences, Yishun Health. Adjunct Assistant Professor Rajesh Rajagopalan, Senior Consultant and Head of Vitreoretina Services at the Energy Eye Institute, Tan Tock Seng Hospital. Associate Professor Colin Tan, Senior Consultant, Head of Research, Head of Fundus Image Reading Center, Clinician and Researcher at the Energy Eye Institute, Tan Tock Seng Hospital. Distinguished guests, colleagues, ladies and gentlemen, a warm welcome to all of you here. We are all here today once again on this virtual platform to mark the launch of Awareness of Macular Diseases, that is the AMD Week 2021. This is an annual nationwide campaign aiming to promote public's awareness of macular diseases. Ever since 2005, when the AMD Week was initiated and led by the Department of Ophthalmology and Visual Sciences, Khoo Teck Puat Hospital, the key objective of this campaign has been to promote awareness about various types of macular diseases, especially age-related macular degeneration. What led to the need for creating this awareness was the fact that macular degeneration is still unheard of for many people in the community, especially the aging population, even though it is the third leading cause of blindness in Singapore. Lack of awareness of symptoms results in many people ignoring the early symptoms of the disease, and then it leads to progression of the disease. Age-related macular degeneration, especially the wet type, benefits with early intervention. So, through our continuous efforts, we hope to educate the public to recognize the disease and its symptoms and seek treatment early so that we can help them maintain good vision and a better quality of life. The COVID-19 was an unexpected pandemic, which changed the way we live and created new normals. Even after over a year, we are still trying to adapt to the daily uncertainties that it poses in our lives. After every wave of COVID, when we emerged from the crisis and slowly returned to normal, we came across a lot of patients who delayed seeking medical care due to the fear of catching COVID. Similarly, we also came across a lot of previously regular patients whose eye conditions had worsened as they were lost to follow-up during this crisis. A delay in treating macular diseases can cause irreversible blindness. Therefore, as we try to adapt to the ongoing pandemic, we need to be aware of important symptoms so that we do not miss any vision-threatening conditions, while at the same time, we must keep in mind to avoid unnecessary trips to the hospital. This year, as the COVID restrictions still continue, we will also carry out the launch on an online platform just like last year. The AMD Week this year focuses on the theme, Your Vision, Our Focus, See Through the Midst of the Pandemic. In our program, we are honored to have highly experienced retinal specialists from Tan Tock Seng Hospital who will answer our questions. We also have short educational videos by our primary eye care providers. We will also have our dietitian joining us to educate us about healthy eating, as well as a very informative segment on coping with low vision. To begin this ceremony, I now invite Adjunct Associate Professor Yip Chi Chu, Head of Department of Ophthalmology and Visual Sciences, Yishun Health, to deliver his welcome address. Prof. Yip, please.
Hi, Professor Chua Hong Chun, CEO, Yishun Health, and Deputy Group CEO, Strategy and Transformation, National Healthcare Group. Adjunct Assistant Professor Rajesh Rajagopalan, Head of Vitreoretina Service and Senior Consultant, NHG Eye Institute at Tan Tock Seng Hospital. Adjunct Associate Professor Colin Tan, Head Research and Head Fundus Imaging Reading Center, Senior Consultant, NHG Eye Institute at Tan Tock Seng Hospital. Distinguished guests, ladies and gentlemen, good morning. It is my pleasure to welcome you to the launch of the Awareness of Macular Disease Week 2021. Today marks the 17th anniversary of this nationwide initiative since its inception by the Department of Ophthalmology and Visual Sciences back then in Alexandra Hospital and now in Khoo Teck Puat Hospital. Since 2005, we have organized this event yearly, and the scope of this event has expanded in recent years to include all diseases affecting the macula, not just age-related macular degeneration. When we first launched this event, we envisaged this initiative to bring together eye care partners from various public and public sectors together to raise the profile of age-related macular degeneration, which at that time was not widely known. As the years passed, more partners have come on board to work with us on this very meaningful campaign. Our focus is to provide eye screening to members of the public aged 50 years and years old. I would like to extend my deepest appreciation to all our partners who have been with us in this long journey. The achievements and progress we have made in creating greater awareness of macular diseases would not have been possible without your invaluable support and participation. However, due to the evolving COVID-19 situation and safe management measures, we are unable to continue the annual eye screening. Instead, we encourage our seniors to screen for themselves. We encourage you to download the Macular Amsler Testing application, MATA, KTPH. MATA, you know, in Malay stands for eye, but this is really an app that actually targets towards detecting and monitoring age-related macular degeneration, one of the most common age-related macular disease. Users can download it from both the Apple and Google Play stores. With that, I encourage everyone to take this opportunity to learn more about macular diseases and check your own eyes if necessary. On behalf of the organizing committee, I thank you once again for helping us achieve this milestone of 17 years. Let us continue working together to tackle and fight these eye diseases. I would now like to invite our distinguished guest of honor, Professor Chua Hong Chun, CEO of Yishun Health and Deputy Group CEO of NHG, to deliver his keynote address. Prof. Chua, please. Thank you.
Prof. Yip, Senior Consultant and Head Ophthalmology and Visual Sciences Department at KTPH. Prof. Rajesh Rajagopalan, Head of Subspecialty, Vitreoretina and Senior Consultant, NHG Eye Institute at Tan Tock Seng Hospital. Professor Colin Tan, Head Research, Head Funders Imaging Reading Center, Clinician Researcher and Senior Consultant, Department of Ophthalmology, Tan Tock Seng Hospital. Distinguished guests, ladies and gentlemen, good morning. I'm delighted to be here with all of you today. As Prof. Yip has mentioned, this is the 17th run of the Awareness of Macular Diseases Week. It is also the second year that this event is being held on a virtual platform. So many of you are able to zoom in from the comfort of your home to learn more about AMD. Let me say a few words about AMD Week. As Prof. Yip mentioned, Awareness of Macular Diseases Week is a nationwide event. It's aimed to promote awareness of diseases affecting the macula. This is the central area of the retina and the most important part of the retina because it serves central vision. Macular diseases include common eye conditions like age-related macular degeneration and diabetic maculopathy. Now, in Singapore, the prevalence of early macular degeneration is estimated to be 5%. That's 5 out of every 100 individuals. And 0.5%, that is 1 out of 200 individuals, suffer from late disease. Now, I'm sure many of you, like me, would know someone, an elderly relative or friend or a parent of someone that you know who may have these conditions. Because diabetes actually is very common in Singapore and it affects 10% of our population. And we know that 7.6% of diabetics will suffer from macular problems. So we need to understand these conditions and also need to understand that early detection and prevention, very important and is possible to help many of us who may be at risk. This event The participants will learn about the available support and community resources that will help all of us navigate through times of uncertainty. Eye conditions often occur as people age, and some of these conditions may lead to vision loss, and this can be very devastating. However, the good news is that if it's caught early, many of these conditions can be preventable. Early detection, therefore, is the best way to ensure that you can continue to see clearly for years to come. Now, usually during the annual AMD week, Yishun Health and our partners will provide eye screening for age-related diseases at various touch points, such as hospitals, community centers, or optical outlets. And where at these places, members of the public will be able to learn more about conditions and be able to be prepared for this journey. However, I understand that this year, we are unable to continue with the screening efforts. Nevertheless, we will have other ongoing online activities that you can continue to learn and participate with us. Let me just say a few words about the impact of visual loss. Actually, the fear of losing independence and the fear of the unknown is very real. Loss of function has great emotional impact on people. I am a practicing psychiatrist and I understand the mental health impact is very devastating. And actually a lot of people worry about the loss of various senses and functions. And actually one of the most fearful losses actually is the loss of vision. And it is quite terrifying to conceive the thought of dealing with loss of vision. And actually it can be very frightening. There are people who are managed to adapt and adjust themselves at navigating themselves into a new situation, even if they have some of these conditions. How does a person deal with the changes is very important. And there are many, many ways to help. Facing the conditions, learning early is one of the best approaches. So by participating in talks and events like this, you are helping yourself to stay ahead and to be prepared. You will find the support and resources that can help you to adapt and maximize your independence. And this will help to keep anxiety and depression at bay. So in closing, let me remind you and all of us that we are not alone in this journey of eye care. So don't isolate yourself, reach out and find the support that you need. If you have a problem, the earlier the plans that you make, the more prepared you will be. So let us continue to work together, all of us, our partners, as well as all of you, to find ways to help and support each other. I would like to thank the organizing committee and all our partners from putting this event together. Thank you very much. I wish you all an enriching and enjoyable event ahead. Thank you.
Thank you, Prof. Chua. I would like to definitely emphasize on one point that Prof. Chua mentioned in his address. Remember, you are not alone. So let us continue to work together and find ways to support each other and overcome the fear. We will now move on to the launch of the AMD Week 2021. For that, I would like to invite on the virtual stage here Professor Chua Hong Choon, the CEO, Yishun Health, and the Deputy CEO, Clinical at the Energy Group. Adjunct Associate Professor Yip Chi Chu, Head and Senior Consultant, Department of Ophthalmology and Visual Sciences, Yishun Health. Dr. Benjamin Chang, Deputy Head and Senior Consultant, Department of Ophthalmology and Visual Sciences, Yishun Health. Adjunct Assistant Professor Rajesh Rajgopalan, Senior Consultant and Head of Vitreoretina at the Tan Tock Seng Hospital. Associate Professor Colin Tan, Senior Consultant and Head of Research at the Tan Tock Seng Hospital. And I would also like to invite our Senior Consultant, Dr. Lekha Gopal, the Organizing Chair, and the Co-Chair, Dr. Maheshwar, to this virtual stage. So thank you for joining in on this virtual stage. So as you all know, no webinar or a virtual program is complete without a group photo. So let us begin this launch with a group photo. So everyone, 1, 2, 3, cheers. Yeah, thank you so much. Thank you for joining in. So for the past many years, the AMD week would be usually inaugurated by lighting up a launch pad with a symbolic eye. This year, as the program is virtual, we will be launching the AMD week virtually too. During this launch, we will be revealing our official AMD week logo. What's interesting about this logo is that it's a prize-winning logo designed by one of our participants, Dr. Preeti from NUH, during the Yishun Health Community Ophthalmology Medical Competition, or the YHCOM competition in short. I will be sharing more about this competition later in the program. So without further ado, let's put our hands together to initiate the AMD Week 2021. That was a very beautiful logo. Thank you, everyone. With that, this year's campaign is now in full gear. Before we proceed to the main program, I would like to share with all our audience the highlights of the AMD week. We have several talks lined up for you this year for the AMD week. At 11 a.m. today, we have a public forum by the Tan Tock Seng Hospital. There will also be a talk in Mandarin at 1 p.m. today. Also on 12th October, we have talks by the Knee and Polytechnic as well as the Singapore National Eye Centre. If you have yet to register, please scan the QR code or please visit www.ktph.com.sg for more details. Every year during the AMD week, we would conduct nationwide eye screening. Unfortunately, this year, due to the current evolving COVID situation, there won't be any nationwide eye screening. Instead, we strongly encourage you to do self-monitoring at the comfort of your own home by downloading the Mata KTPH app. As previously mentioned, you can simply scan the QR code or go to Google Pay or App Store and type in Mata KTPH to download the application. Now let's move on to the Eye and Vision Health Awards 2021. The Eye and Vision Health Awards are given to recipients whose achievements and contributions have significantly improved eye care, not only in their respective institutions or within Singapore, but they have also displayed exemplary spirit of public service through involvement in community, welfare, and civic activities. These recipients are chosen by a special committee made up of eye care professionals. Professor Chua Hong Choon, our CEO, will be virtually presenting the award to the awardees in a very special way.
We are pleased to award the following deserving eye care professionals. The Visionary Award goes to Associate Professor Victor Khoo, Head of Department of Ophthalmology, NUHS. The Lifetime Achievement Award goes to Associate Professor Caroline Chi from NUHS. The Lifetime Achievement Award also goes to Clinical Associate Professor Doric Wong, Senior Consultant at the Singapore National Eye Centre. The Distinguished Service Award goes to Dr. Su Sing Yi from NUS. The Distinguished Service Award also goes to Mr. Daniel Chong, Vice President of Society of Opticianry Practitioners. Distinguished Service Award also goes to Ms. Cecilia Fong Patient Service Associate at Khoo Teck Puat Hospital. Next, we have the Young Eye Care Ambassador Award, which goes to Dr. Chris Lim, Chief Resident at NUHS. The Young Eye Care Ambassador Award also goes to Ms. Wong Ming, optometrist at Plano Private Limited. The award for the Corporate Social Responsibility goes to Esila Vision Foundation, ASEAN. We also have an award for Corporate Social Responsibility, which goes to Johnson & Johnson Vision.
A hearty congratulations once again to all the recipients of the Eye and Vision Health Awards. Wishing you all a very best, and we thank you for your contribution and service. Thank you also for being an inspiration to all of us here today. With this, we will move on to our live question and answer session with Adjunct Assistant Professor Rajesh Rajgopalan and Associate Professor Colin Tan. Adjunct Assistant Professor Rajesh Rajgopalan is a Senior Consultant and Head of Subspecialty Vitreoretina at the Energy Eye Institute, Tan Tock Seng Hospital. Associate Professor Colin Tan is also a Senior Consultant at the Tan Tock Seng Hospital. He also heads research, and he is the head of the Fundus Image Reading Center, clinician and researcher at the Energy Eye Institute, Tan Tock Seng Hospital. So good morning, Prof. Rajesh and Prof. Colin. A very warm welcome to all of you on behalf of the organizing committee. Thank you so much for joining us here today.
Thank you for inviting us. Thank you very much.
Thank you.
I hope you're enjoying the virtual AMD Week launch so far. So earlier we had actually asked the public to share few queries on macular diseases, which they would like to ask an eye care expert, and we did get quite a response. From these queries, we have selected some most frequently asked questions, and I shall be asking them on behalf of the audience. So let's proceed to the questions, shall we? Okay, so we have the first question here. How fast will your eyesight deteriorate when you are diagnosed with AMD? Is it okay to decide treatment after a few months of diagnosis? So whenever any of us is suggested some treatment for a medical problem, the first thing we want to know is how long can I wait, or is it urgent? Let's see what Prof. Rajesh has to say with regards to AMD. Dr. Rajesh, please.
Thank you very much. That is a very good question, and most of us have this doubt for any part of any disease that one has. The most important question is when should you get treated and how long you can wait or delay depending on the condition. So it also depends upon the disease condition at the stage of diagnosis. So in Singapore, there are a lot of screening programs. So people are diagnosed much more earlier. And so the wait time or for treatment can be varied depending on and what is the time frame at which the diagnosis is made. Broadly, AMD can be classified into early, intermediate, and late stages. So if a person is asymptomatic, they can still be diagnosed with the disease if they go for routine screening, especially after the age of 55. When they go for screening, the doctor or the polyclinic may detect them to have some disease pattern. Actually, they are asymptomatic. So these patients are referred to the hospitals probably within a month or two, and that is good enough to wait. But however, there are patients in late stages of the disease who have already got symptoms of blurred vision or distorted vision or seeing dark patches in the vision. These patients, these patients are already having an advanced stage of the disease. So, and they should be treated at the earliest possible time. So the time frame for which the disease has to be treated depends upon the staging of the disease. So when they are in the late stages, treatment at the earliest is the best option. So they need to approach the one of the tertiary hospitals for treatment based on the the referral criteria, and some may be referred on urgent basis.
Okay. Thank you, Prof. Rajesh. So, as he said, the stage of the disease is important. If you're already in the late stages, let's not wait too long and try to get treatment early. Now, we move on to the next question. So, can children also get macular diseases or macular degeneration? Is it only for the elderly? If my father has macular degeneration, can I get it too? So definitely family history is very concerning. Whenever we see our parents going through a disease, we always wonder, can I get it too? Or will my children also be affected? We have Prof. Colin here who will help us answer that question. So Prof. Colin, please.
Okay, thank you. That's a very good question, and it's a common question that we often get from our patients as well. So firstly, if we're talking of macular degeneration, of course, there can be a variety of causes, but we're talking of age-related macular degeneration, then as the name suggests, then only people who are older, typically above the age of 60, would tend to get this. Children will not get age-related macular degeneration. They could, of course, have other types of degeneration, perhaps inherited diseases. So going back and focusing on age-related macular degeneration, if a patient, sometimes if a younger relative says if their parent has macular degeneration, are they at risk of getting it? Possibly. There is a potential genetic component to this, so there could be some risk factor based on family history, but it doesn't mean that they will definitely get it. And it also does not mean that if there is no history that they will not get it. So the best way is to get their eyes, if there is any concern, is for a person to get the eye screen for any kind of retinal diseases.
Okay, thank you, Prof. Colin. So with that, we move on to our next question. I have symptoms of AMD in my right eye. Could I also get it in my left? And is there anything I can do to prevent AMD? Yeah, so definitely, yes, you get one eye involved, your vision is less, we're always scared. Will my other eye be affected too? And yeah, we believe in prevention. So is there anything we can do to prevent this? I would request Prof. Rajesh to kindly answer that question.
Thank you. So if one is diagnosed with age-related macular degeneration of one eye, there's definitely a higher incidence of the disease occurring in the other eye. So these people should be screened regularly for symptoms in the other eye or disease activity in the other eye. And various studies quote various percentages of incidence depending on the various types of AMD. So actually, the good thing is because one eye is affected, these patients are under constant surveillance or under follow-up with the ophthalmologist for the condition, and they have got the opportunity to get the other eye screen. Though the risk is there, the risk profile can be modified by lifestyle adjustments like quitting smoking. Smoking is found to be one of the most important risk factors for development of age-related macular degeneration. So if a patient is a smoker and has got one eye affected by age-related macular degeneration, then the best thing would be to quit smoking to reduce the risk of affecting the other eye. There are other supplements like the ARDS supplements with antioxidants and vitamins, which also have known to decrease the incidence of AMD around 25 to 26%. So these patients can be started on these supplements and they can take green leafy vegetables and also quit smoking and control their obesity or hypertension. And these are all the known risk factors for the onset of the disease. And even though one eye is affected, these lifestyle changes can be made so that the chances of the other eye getting affected is lesser. But the patient will still need monitoring by an eye specialist for early detection in the other eye, in addition to being treated for the affected eye.
Okay, thank you, Dr. Rajesh. Yeah, so the other eye, you definitely have to screen if one of your eyes is affected, and lifestyle modifications can help prevent the occurrence of AMD. Let's move on to the next question. Okay, so we have one of the diabetic patients here who says, I'm a poorly controlled diabetic. Can I get macular problems due to diabetes? I have heard about injections for the eye in diabetes. Is there any oral treatment option available? Well, it's but natural. We always prefer pills to jabs, don't we? So, Prof. Colin, do we have an option here?
Okay, so that's a very good question. Firstly, maybe let me just quickly address the question, can they get macular problems due to diabetes? And the answer is yes. The photo on this slide, for example, shows a patient with what we call hard exudates, those yellow spots at the macula. And this is typical of what we call diabetic maculopathy or diabetic macular edema. So there's swelling at the central portion of the eye, which then causes poor vision. And the typical treatment for diabetic macular edema are injections of drugs into the eyes. Right now, there is no oral treatment for diabetic macular edema. However, what patients can do is to optimize their diabetic control. For this, they need to work with their endocrinologists or their GPs to have the best possible diabetic control. That will typically be oral medications or insulin injections. There's also some suggestion that fenofibrates can be used to help control a bit of the diabetes, the effect of diabetes. However, this is also not for everyone. And again, this needs to be done in conjunction with either the endocrinologist or the general practitioner.
Yeah, thank you, Prof. Colin. Yeah, so for diabetics, for now, for macular edema, yes, we do not have an option other than injections. But yes, optimizing your diabetic control can definitely help preventing macular problems or diabetic retinopathy and reducing the risk of progression. Let's move on to the next question. Can I go totally blind due to any of the macular diseases? If I lose my sight, what happens next? Can corneal transplant help? Sadly, we always fear this whenever we get an eye problem. Can I go blind? So, Dr. Rajesh, your comments, please.
Yeah, so this is one of the most important questions because most of us are worried if any disease pattern is actually affecting the eye, whether you'll go totally blind and will permanently disabled is a question now. So to address this, actually macular diseases, especially age-related macular degeneration, affects the center part of the visual field. So the reading vision is predominantly affected now. So this can cause progressive loss of vision, and usually age-related macular degeneration does not lead to total darkness of vision. It affects the reading vision, and so the patient may not be able to read the biggest letter in the chart, so which is termed as legal blindness. So for the purpose of classifying, they are classified as blind, but still they will be able to navigate around with that amount of vision in most of the cases. So it again depends upon the stage of the disease. So if you are diagnosed at a much earlier stage, most of the time the vision can be stabilized, and in some of the cases the vision can be improved, though it cannot improve to perfect, but it should be able to be reasonably be treated well. So early diagnosis and treatment is the most important thing in age-related macular degeneration. So at the end, as a late sequelae of the disease, because of non-treatment or non-responsiveness to the treatment, it may eventually lead to scarring of the center part where the vision is permanently damaged, the reading vision is permanently damaged. These patients do have an avenue of rehabilitation. So they can use modern gadgets, and they can use a lot of variety of visual rehabilitation equipments to make their lifestyle better. So there is still some avenue for treatment at every stage of disease. And the most important thing is patients should seek the right care at the right time. And the next question is, can corneal transplant help? Corneal transplant is mainly used for corneal blindness, where there's opacity in the cornea or the front part of the eye, whereas the age-related macular degeneration and other macular diseases are disease of the retina, which is part of the brain and nerves passing to the eye. So these cannot be treated by corneal transplant. There are newer varieties of implants like the retinal implants, I think, which are being tried, but no definitive outcomes yet. There are a lot of research going on in this area, and some of the implants are approved, but there are specific indications for use of these implants, and more are bound to come in the near future. Thank you. Hope that addresses your question.
Yeah, thank you, Dr. Rajesh. Yeah, so let's hope a lot of retinal implants and other innovations come up which can help to even treat the later stages of the disease in macular degeneration. But as Dr. Rajesh said, corneal transplant does not help because that only helps in treating corneal blindness, but not a retinal problem. So let's take our next question. Okay, so I work long hours and I find my job stressful. I am diagnosed with central serous chorioretinopathy. I read that stress can cause my eye condition. How true is this? Well, we all go through a bit of stress, either due to jobs or some other issue. And now even COVID has added so much to our stress in various ways. So Prof. Colin, what would be your words of advice for this patient?
Okay, thank you. Well, that's a bit of a stressful question actually, but I'll try to answer it as best as I can. So central serous chorioretinopathy is caused by accumulation of fluid, typically at the back and the macular region, and oftentimes it involves the center, like in this case, so that it affects vision. Now, the causes of CSCR can be caused by a few different things. Sometimes it is idiopathic. That means we can't find any obvious causes for this happening. However, stress has been identified as one potential risk factor, especially for people who are very high strung, what they call the type A personalities. They are perhaps at a greater risk of developing this condition. So what we often have to tell patients if they do admit to having, experiencing stress, is that they need to address this stress and try to control it, because this can potentially have an impact on the eye. All right, and sometimes they may even need some professional help for counseling, or even possibly to see a psychiatrist like Professor Chua Hong Chun for review and advice. However, I would also like to mention that some patients without experiencing stress can also develop CSCR. So it's not necessarily to say that the moment they control the stress that it will go away or that it will not happen, but at least it reduces the risk.
Thank you, Prof. Colin. Yeah, so as he said, stress is definitely one of the risk factors, but it's not 100% of a risk factor. So because you don't have stress doesn't mean you will not develop this. You may develop it also, but tackling your stress can help, avoiding this condition. Moving on to the next question. Okay, so this is a very routinely asked question by all patients we see in our clinic. We are faced with this question every time we advise treatment, even during the treatment and as the treatment is going on. So I am taking injections for AMD in the eye. How long does one need to take injections? Is there a fixed number of injections that a patient needs to take? So Dr. Rajesh, I'm sure you are also asked this question multiple times. So could you kindly elaborate on that, please?
Yeah, thank you. So this is a very important question that all patients ask whenever they come to the clinic and diagnosed with new age-related macular degeneration. And the answer to this question is what is worrying for most patients, but actually it is not so bad. So age-related macular degeneration, everyone knows, is a chronic disease. It is something like diabetes or high blood pressure. So diabetes, people take medications every day, injections every day, depending on the stage of the disease. And age-related macular degeneration is also a chronic disease where you need prolonged treatment. So where the treatment is in the form of injections. So about 2 or 3 decades back, when there was not much of treatment for this condition, people were going blind and nothing much could be done because the disease process led to a scarring, and the treatment also led to a scarring and drop in the vision. But a newer modality in the form of injection, that is injection into the eye, was invented, and this led to improvement of vision in these patients, in a group of patients. So this improvement in vision was a boon to people with age-related macular degeneration. So from then on, it became injection, and the psychological aspect of the injection is an injection into the eye, which puts off most people off, and they don't come for follow-up. But actually, it tends to help to stabilize and also improve the vision in a majority of patients. So, but the injection is a monthly injection. So people start off with 3 injections because the research study has shown the first 3 injections gives the best response. And so they load the first 3 injections on a monthly basis. And the subsequent schedule of the injections is depending upon the treatment response, which may be continuing ongoing as monthly or once in 2 months, or depending on how the disease responds to the treatment and stabilize the condition. So the interval between the injections can be spaced out, and for some patients, you can be able to stop the injections for a while and start treatment when it recurs. So there are different ways of treating, and there are also newer modalities of treatment where there's a port delivery system where they implant a device, which is slow release device, which releases the medication, and it can be refilled at periodical intervals, probably once in 6 months to a year, so that the drug is delivered into the eye on a regular basis instead of the need for repeated injections. Singapore is one of the centers where this research trial on the port delivery system is going on, and the initial results are very promising, and we do expect that a lot of patients may not need to inject that frequently in the near future when the drug or the system gets approved for clinical use. So this is about the duration of the injection, and because of the chronicity of the disease, usually people will need long-term follow-up or long-term injections, and they should be mentally prepared for coming multiple visits. And when the disease stabilizes, the number of visits and the number of injections can be reduced or maybe totally weaned off. But the initial 1 year, I will usually tell patients like it's around 8 to 9 injections in a year.
Okay, thank you, Dr. Rajesh. So let's go to the next question. My mother has macular degeneration and cataract. Can vision improve if she does cataract surgery? Well, more than one problems always confuse us whether we should treat the additional problem or just leave it. Prof. Colin, I'm sure a lot of patients ask you this question. So what do you advise these patients?
Right. That's indeed a very common question that we get from our patients and their relatives. And it's an important question. So it depends on the severity of both the cataract as well as the macular degeneration. So let's say the patient has just a mild form of macular degeneration and quite a significant cataract, an advanced cataract. Then certainly if we were to take out the cataract in this case, the patient can potentially expect to have an improvement in vision because the primary cause of the visual loss is caused by the cataract. Now, on the other extreme, if there is already a scar or at the back of the eye caused by macular degeneration, then we know that the central vision is lost. So the patient, no matter what, will not be able to see any better because of the presence of the scar or what we tinning, an area of tinning called atrophy. Now, in such cases, even if you remove the cataract, because the back of the eye is damaged, the patient will not expect to see better. All right, the analogy we use is like a camera. Even if you remove the lens in front and change it to a better lens, if the film at the back of the camera is damaged, then you won't get a good picture. Having said this, even in such patients, if there's an advanced cataract, potentially removing it could make things appear brighter for them. And as they also have peripheral vision, so that could potentially help them. So the best advice I would give to any of these patients is to ask your doctor carefully and discuss the pros and cons with them, because they can weigh the effects of both the cataract and the macular degeneration and give you the best possible advice.
Thank you, Prof. Colin. Yeah, so let's quickly move on to the next question. I'm 35 years old. I'm also short-sighted. Is there anything I should do to prevent any macular diseases? Any vitamins that I should take? We all love colorful pills, don't we? So, Dr. Rajesh, your comments, please.
Yeah, this is very important in Singapore because a majority of the population have myopia, and this starts right from childhood, and the myopia progresses, and is one of the most important factors because high myopia, where the myopia is more than 6 diopters or the length of the eye is more than 26 millimeters, the chances of other complications happening like myopic macular degeneration or myopic choroidal neovascularization, where there's abnormal blood vessel growth in the center part of the eye, which is something similar to age-related macular degeneration, which happens in high myopes. These can also cause a visual loss or some macular scarring and permanent drop in the vision. So the most important thing in myopia is to delay the onset of myopia, especially by doing screening during the earlier part of the life, like in the school screening is there in Singapore where the people get screened. The most important thing, outdoor activity has found to have decreased incidence of myopia. So children should play out and they should have more of outdoor activities. And second thing is once there's diagnosed as myopic, the slowing the progression of the disease is also important, like atropine treatment and other orthokeratology or peripheral defocus lenses have been tried. And these are all some ways to delay the progression of myopia once a diagnosis is made. But at the age of 35, already the myopia has set in and not much to be done. If you are high myope above 6 diopters, then it is better to be screened periodically, or when there's early onset of symptoms like blur vision or metamorphopsia or distorted vision, then it is better to check with an ophthalmologist. And there are treatment modalities like injections in the eye which can stabilize the condition. So vitamin intake for myopia as such has not been studied, or it is not found to be much benefit. It's more for age-related macular degeneration that vitamins are used, especially the ARED study which provided the vitamins for supplements for age-related macular degeneration and not for myopic macular degeneration. Myopic macular degeneration at the age of 35 and above is more of monitoring and treating in the right stage. Thank you.
Thank you, Dr. Rajesh. So due to time constraints, we will take one last question too. So my father is 68 years old. He always watches videos on his phone in the middle of the night. So I'm worried he would get macular disease. Is that possible? And can Blu-ray blocking glasses help prevent macular diseases? So Prof. Colin, how would you answer that?
Oh, thank you. Well, you seem to be giving me a lot of the stressful questions, but okay, let's address that. So yes, a very common feature is that patients will use their phones, people will use their phones and watch videos. I wonder why at night. I guess maybe because that's when they're done with the day. And this is even more common nowadays, right? When people are all staying at home and more, and so there's the increased use of various devices. I think the more common symptom that we see from such patients will be dry eyes. And the reason is because they are staring at the phone or their tablets for hours on end without rest. And when you stare at something, when you're concentrating, you forget to blink. And so your eyes dry up. And the blurring that they experience is usually related to this. Now, it's not really been shown that prolonged use of a device will cause actual macular diseases. However, remember that such devices are only fairly recent. It's only in the last decade or so that we use phones to watch videos and such. So who knows what we'll find in another decade or two. But right now, the best advice is for such people is to actually split up the session, to rest their eyes in between so that they don't get dry eyes. And if they do feel dry, to use simple lubricant eye drops. In terms of the Blu-ray blocking glasses, does it prevent macular diseases? I think the jury is still out on that. There are different bits of evidence. There's some suggestion that blue blocking glasses can be helpful for those who have had their cataract removed, but not everyone entirely. How much that effect that is a bit uncertain, and the jury is, as I said, is still out on this. But one thing I can say is that it doesn't mean that because you have Blu-ray blocking glasses that you do not need to worry about macular diseases. There are other factors that will cause macular diseases, and so it's still important to get your eyes screened and have regular checkups.
Thank you, Prof. Colin. So with that, we come to the end of the question and answer session. I thank you, Dr. Rajesh and Prof. Colin, for your valuable inputs in this session. It was an honor to have you both for our AMD program. And I'm sure this session has helped clear quite a few misconceptions and enlighten the public. So in the next segment, we will move the focus onto the community. So when most people think of eye problems, it's usually the opticians and the optometrists who first come to their mind because of the ease of access. So before visiting a doctor, a patient always likes to check with the opticians if just a change of glasses would help their vision problem. Optometrists thus play a very key role in eye screening, and they're usually the first point of contact for the public. They are the ones who spot a lot of warning signs or red flags and make appropriate referrals when necessary. We have a short video on eye care in the community by Ms. Chui Wenjun, the Vice President of the Singapore Optometry Association.
Hi everyone, my name is Wen Juan and I'm from the Singapore Optometric Association. Today I'm going to share with you eye care in the community, what optometrists can help you with in eye care. So I'm going to explain some of the tests that we do, eye care tests, and why we do it, and some take-home messages for today. So this will be very familiar to you. It's a check for the eye power. It's also called refraction, and refraction just means bending of light. And what we want to do is to focus light on the retina to give you clear vision. Now we need to understand that it doesn't mean that we give you more power in your lenses that you get better vision. What we want to find is your best acuity, which is the smallest detail that you can see. And it doesn't necessarily mean that that is your prescribed power, because when we prescribe a prescription for you, what we want is to give you what's most comfortable and functional. And of course, because most of us have got two eyes, we want to make sure that your two eyes work together comfortably, and it doesn't mean that both eyes are necessarily the same. So what are the kinds of refractive error or powers of the eye? So the common ones are myopia, which is short-sightedness, and hyperopia, which is long-sightedness. So ideally, in a normal vision, the light is supposed to be focused clearly on the retina, and that's how we get clear vision. In myopia or short-sightedness, light from distant objects are focused in front of the retina, whereas in hyperopia or long-sightedness, light from objects is focused behind the retina, and this is different to presbyopia or laohua, because hyperopia only refers to seeing things in the distance. In astigmatism, what happens is light gets distorted and it's spread across multiple points instead of a single point. And it can come from the cornea, which is the front of the eye, or from the inside of the eye. So apart from checking power and vision, we also check the eye health. And some of you may have seen this machine before. It is actually a slit lamp. It's actually a microscope system with lighting, and it allows for a cross-sectional view of the front of the eye. Now, when we look at the front of the eye, we're interested mainly in the structures that's in these blue boxes. And we can see lots of things from eyelid abnormalities to the cornea, to the iris, and of course to the lens in the eye. So here are some examples of some of the conditions that we can see using a slit lamp. This is an inflammation of the eyelid. This is some corneal ulcers and scarring. This is a case of an acute angle closure glaucoma. We can also notice if there's any abnormal growths on the iris. And of course, one that you have heard commonly is cataracts. So from the front of the eye, we go to the back of the eye, and this is called a retinal exam. And we often use an instrument. They may look something like this, a retinal, or also known as a fundus camera. And so these are the structures in the blue box that we're interested in when examining the back of the eye. So how does a normal retina look like? Well, it kind of looks like this. This is a normal left retina. And some of the landmarks are here. This blue circle, which is the macula. And in the square box here, it is the nerve, which is like your transmission cable that relays information from your eyeball to your brain. So essentially what we want to check for is anything that's missing, broken, or not supposed to be there. So here we can see there's bleeding in the retina that's seen in diabetic eyes, or if the nerve of the eye is pale, or if there are tears or detachments in the retina. And of course, this being AMD week, we see there are two examples of macular degeneration. And on the right here is the wet type or bleeding type. On the left here is the dry form of age-related macular degeneration. We also want to check functional vision. And sometimes when somebody says, oh, things are blurred, we want to find out, is it blurred due to a power problem, which can be corrected with glasses and contact lenses? Or is it because of distortions in the macula? And so you may have seen some variations of an Amsler chart. It's generally charts with lines or stripes or dots. And someone who has macular degeneration may see something like this, distortions or a grayed out or a blacked out part of their vision. So last but not least, we also measure the pressure of the eye. Now, all eyeballs have pressure because there's fluid in it. But what we want to check is that the eye pressure is not excessive, because it can cause damage to the back of the eye, particularly the optic nerve. So there are a few ways of checking eye pressure. Some of us use a machine that uses a puff of air. Some clinics may use some blue light after the doctor has put some sticky yellow solution on the eye, or there is another handheld contraption that can also measure the eye pressure. So how often should we check our eyes? It is recommended to have a 2-yearly eye check for those 40 to 60 years old, and for those older, 60 and above, an annual eye check. Of course, if those who have got existing conditions or who have high myopia, which is -5 diopters or 500 degrees and above, or are at risk of eye conditions, it is recommended to be seen 6 to 12 monthly. And remember, an eye test is not just about seeing a letter chart, it's about a whole of eye exam. And eye tests can also be made relevant to your situation. So for example, if you're diabetic, or if you happen to be suffering from headaches, or you have occupational needs, your eye test can be tailored for you. So the macula is an important part of the eye, but there are also other parts which are just as important. So remember, if you do need screening for eye disorders, or if you do wear contact lenses, ask for the optometrist, and you can refer to this website, oob.gov.sg, for a list of optometrists and opticians. So I thank you for your attention, and I wish you safety and being well at this time. Thank you.
Thank you, Ms. Winjin, for the insightful sharing. Now let's look at another video clip from Ms. Caroline Lau, Secretary, Society of Opticianry Practitioners. She is the optician and owner of Eye Care, and it shows a brief description of your eye screening journey at an optical shop.
My name is Caroline. I'm an optician and owner of Eye Care. During AMD week, some optical stores will provide eye screening at a nominal fee of $5. AMD is a common eye condition affecting elderly patients over 50 years old. The symptoms of AMD will develop gradually, and it is highly encouraged for the elderly to have an annual eye check. These are the steps that practitioners will go through when you visit an optical store. Firstly, we start with history taking, where patients will share with us their existing medical condition and family history of eye health. Next, we will conduct an eye check using the autorefractor to get a rough estimation of your eye prescription, and thereafter move on to subjective refraction to further confirm your degree. You will be asked to identify either letters or numbers in the screen in front of you. Following that, a near vision test will also be done to confirm your near reading power. We will then move on to the Amsler grid test to identify signs of AMD. In this test, you will be required to sound out any lines that appears distorted or disarray to you. An optometrist will then check the anterior segment of your eye during our slit lamp examination. This is to check for certain conditions such as cataract. A fundus photo will also be taken to assess the posterior segment of your eye. This is to identify any signs of AMD on your retina. Lastly, the optometrist will interpret the results to the patient and refer to the ophthalmologist if necessary. If you think you need an eye screening, book an appointment with us today.
Thank you, Ms. Caroline, for that wonderful and precise presentation. So we saw how even opticians can help do a thorough eye screening and guide patients in case they have eye problem. Next, we have Ms. Deirdre Lan, our very own senior optometrist at the Department of Ophthalmology and Visual Sciences, Yishun Health, who will enlighten us about functional screening by population health. Ms. Deirdre, please.
Hi. So good morning to all. A brief intro of myself. I'm Deirdre, a clinical optometrist at the eye clinic in Yishun Health. So together with a team of optometrists, we are running the Level 2 eye screening and Project Silver screening, providing comprehensive eye screening and management within the community. This service was first introduced as Community and Home Eye Screening Service, known as CHAS, in 2017, which aims to detect early eye diseases in the community. And it was subsequently incorporated into Project Silver Screen in 2018. The Project Silver Screen involves population health nurses, the healthcare assistant team, and optometrists. This initiative has received good feedback from seniors. Through this eye screening, they have raised their awareness of eye conditions such as age-related macular degeneration, cataract, glaucoma, and diabetic retinopathy. As an optometrist running this service, there has been a sense of job satisfaction in helping to improve the overall quality of life for the seniors through early detection of eye conditions. Appropriate management such as ethical correction and discharging seniors with normal eye finding has also helped to avoid the hassle of hospital visits for them. Have you participated in any of the mass screening offered under Project Silver Screen? If not, ever wonder what are the tests that are done during the screening? The eyes, ears, and mouth are checked during the functional screening. In the upcoming video, we'll be sharing in detail the tests that are done during the eye screening component. Let us bring you through a journey where you appreciate the different examination that is available to our seniors above 60. Sit back, relax, and let us watch what Project Silver Screen all about.
Project Silver Screen is a collaboration between Ministry of Health and Temasek Foundation. It is made possible by the Health and Wellness Endowment gifted by Temasek, as well as support from corporate donors and community partners. It is a nationwide functional screening program. Let us take you through a preview of what this screening is about.
Do you know what functional screening is? It's a simple checkup to make sure your eyes, ears, and mouth are all in good health. And you can get yours done right in your neighborhood. Check your eyes to make sure you can see clearly. Get the right treatment for any eye conditions, or see if you need a new pair of glasses. Good eyesight will reduce our risk of falls. Check your ears to make sure you can hear clearly. Good hearing is important. We need it to enjoy chatting with our friends and family, and to enjoy the songs and shows we love. Check your mouth to make sure it's healthy and pain-free. We want to keep enjoying all our favorite food. Check your eyes, ears, and mouth. It's important to get checked so you get the right treatment early if you find any conditions. This is so you can see better, hear better, and keep enjoying the food you love. Go for functional screening in your neighborhood. Get healthy and get more from life.
So, functional screening consists of 3 simple checks to ensure your eyes, ears, and mouth are in good health. Functional screening and its subsequent follow-ups are available at accessible locations within the community. Do scan the QR code and sign up if you are interested. Singaporeans aged 60 years old and above are eligible for functional screening. Various subsidies are applicable. After registration, you will proceed to get your eyes, ears, and mouth checked. You can then collect your health report at the Education and Counselling booth. If you require aids such as spectacles, we will check if you are eligible for the Seniors Mobility and Enabling Fund. Whereas, if you require further assessments, we will refer you for Level 2 screening. Oral and hearing assessment are done for early detection of oral and hearing decline. With good oral and hearing health, you can eat and hear better. We will bring you through the journey of seeing better. Seeing better at Level 1 is led by Health Promotion Board appointed vendors, our nurses, and healthcare assistant team. A basic vision assessment using the Snellen charts and pinhole test will be done to know how well you can see. Normal or abnormal vision is determined by the ability to see the Snellen 612 line with the help of a pinhole occluder. If your vision is good and does not require follow-ups, you may go through G-Care, also known as Glaucoma Community-Based Augmented Review and Empowerment. G-Care is done to assess your risk of glaucoma. So, what is glaucoma? Glaucoma is a silent thief of sight, which is a common cause of blindness without any symptoms. Hence, Yishun Health has pioneered G-Care as an additional component to functional screening. This initiative aims to detect glaucoma at their early stage, even in seniors with good vision. For G-Care, you will do a questionnaire checklist to determine your risk, undergo shadows test, and eye pressure measurement. If findings are abnormal, you will be referred appropriately for tertiary care. Do note that availability of G-Care service may be subjected to changes. We have talked about those with good vision. What if your vision is abnormal? Don't worry. We will refer you to Level 2, which is led by our team of optometrists. At Level 2, these are the series of tests that are performed. Some of these will be elaborated in detail shortly. Obtaining the intraocular pressure, also known as the pressure of your eye, is one of the ways to help determine your risk of glaucoma. Glaucoma, as previously mentioned, is an eye disease that can lead to irreversible vision loss if untreated. The Amsler chart. It is a useful tool that can help detect early signs of retinal disease, specifically at the macula. The chart may be occasionally dispensed for home monitoring as well. Next, we will conduct the slit lamp examination. This examination is similar to looking through a microscope to pick up any abnormal structures of the eye. Fundus photography involves photographing the back of the eye, also known as the fundus. It is non-invasive and allows the optometrist to review your retina in detail. If the findings are normal, you may be discharged or referred to our fellow optician or optometrist for glasses correction. You are also encouraged to participate in screening within the community when opportunity arises. The common eye diseases seen in the community includes cataract, diabetic retinopathy, age-related macular degeneration, and glaucoma. If there are any abnormal findings, you will be eligible for direct and subsidized referral to the specialist outpatient clinic seen by our ophthalmologist. Our specialist outpatient clinics are located at Admiralty Medical Centre and Khoo Teck Puat Hospital. We have come to the end of the video. We would like to thank the following organizations. Thank you for your time.
Thank you, Deirdre, for explaining about the newly introduced G-Care for glaucoma screening as well, along with the normal eye screening. So once you're screened in the community and found to have an eye problem, the next level of consult is the hospital. So we will now be playing a short video clipping which will summarize your journey at the hospital if you have symptoms of AMD. We thank one of our senior optometrists, Jasmine Ang and Surya, for their contribution in making this informative video. This video will be followed by a short message by the organizing co-chair, Dr. Maheshwar.
Journey at the hospital. 1 month ago at the optical shop.
Can I make a pair of glasses as my vision is blurred?
I would advise you to seek an ophthalmologist, as it might be age-related macular degeneration, also known as AMD. Usually people with AMD may experience the following symptoms: painless central vision loss, which is either gradual or rapid onset; distorted central vision; black or gray patches in central vision; slow recovery of visual function after exposure to bright light.
Meanwhile at the eye clinic. What brings you here today?
Well, a month ago, I was cooking. All of a sudden, I realized I was not seeing clearly. I rubbed my eyes and realized it is only my right eye. I tried to sleep it off. It didn't get better.
Patient is then assessed by an ophthalmologist.
It looks like you have AMD in the right eye. AMD affects the macula area of eye, which is also important for our central vision. There are two types of AMD. Dry AMD is more common. It is associated with yellow deposits in the retina and loss of vital cells in the macular. This leads to gradual blurring of central vision. Wet AMD is less common and is associated with abnormal blood vessel growth under the retina, leading to leakage of blood and fluid into sensitive cell layers in the macular. This damages the cell, causing vision loss. AMD affects central vision necessary for recognizing faces, driving and looking at details. We have to do a test called FFA and maybe ICG. This test will take approximately 2 hours and it includes a review by the ophthalmologist. Let me explain this procedure in detail. FFA is known as fundus fluorescein angiography. It is a special photographic test to examine the structures at the back of the eye. The doctor will inject a non-toxic dye, called fluorescein sodium, into your arm. The dye will then travel to the blood vessels in the eye. A series of photographs will be taken in the next 10 to 20 minutes to examine blood flow and dye leakage in the eye. A small proportion of patients may require a second dye, indocyanine green, to study a different set of blood vessels in the eye. Let us know if you have any allergies before the procedure. Even though we can't cure AMD, we do have treatments to help clear up some blurriness and try to keep the condition from getting worse. Examples of such treatments is intravitreal injection known as IVT. IVT is where medication is injected into the vitreous or jelly part of the eye. Let me show you a video of the IVT treatment.
Is it painful?
There might be some slight discomfort, but most patients feel quite okay right after the injection.
Do I need this injection just one time?
The number of injections may vary from patient to patient. Usually, we recommend starting with an injection every month for the first 3 months. Then subsequently it will vary depending on the eye condition.
Are there different types of medication?
There are actually 3 different medications.
Are there any other options besides this eye injection?
Another possible option is combining the IVT injection with photodynamic therapy, also known as PDT. Let me take you through. Cold laser treatment is used to destroy the abnormal blood vessels.
Patient decided to go with IVT treatment. IVT procedure is done within a clinic.
After the IVT injection, it is important to keep the area clean, prevent water from coming in contact with your eyes, and return to see the eye doctor if necessary.
Next follow-up visit at the eye clinic will be 4 weeks later.
After the initial IVT treatment, it is important to follow up with the eye doctor 4 weeks later. It is also very important to self-monitor at home weekly between doctor visits for any changes in eyesight or any new symptoms.
During your follow-up visit to the eye clinic, your vision will be checked.
Let's take a closer look into the back of your eyes, and if necessary, repeat intravitreal injection. It is also important to self-monitor at home, to check for any changes in your eyesight between doctor visits, or at least once every week if you experience any new symptoms. We will show you how to do self-monitoring with an Amsler chat at home.
Hold Amsler grid approximately 30 centimeters from the eye. You may wear your glasses if needed. Cover one eye each time during testing. Focus on the center dot with the other eye. Repeat the same for the other eye. If you experience any wavy or distorted lines or any missing grids, arrange to see an eye doctor early.
Self-monitoring using Amsler Grid is also available via MATA, a mobile-based application. MATA, known as Macular Amsler Testing Application, is a basic screening test for central visual function. It is used to screen for conditions affecting the center of the eye sensory layer and the eye nerve. Simply go to either Google Play or App Store to download MATA. I hope that you have a better understanding of AMD.
Thank you.
Good morning, everyone. I am so happy to see you all here. Thanks for taking your time to be with us. Today, I want to emphasize on two important messages. One is the early detection, and two, the timely treatment. The only effective way to prevent blindness is early detection of illness. That is the reason why we are doing this awareness campaign since 2005. We are happy to say that the awareness among public has improved from 7.3% in 2006 to around 40% in our latest survey. So all of us above the age of 55 are at risk of developing macular degeneration. All diabetics are at the risk of macular edema or swelling of the central retina. High blood pressure, high cholesterol, all increase the risk of blood vessel blockage, which can lead to swelling of the macula. So the best way to know if we have a problem is to self-examine. Examine closing one eye and the other eye so that we can make sure that both eyes are quite good. While both eyes are open, we will miss subtle changes in our vision. The more easier way is to use an Amsler Grid or download MATA KTPH app. We also notice many of our elderly patients attribute their blurred vision to cataracts and delay consulting with an eye care professional. I know cataract is the commonest condition to cause blur, but please check with your eye care professional before you make a decision of waiting. The second message is about treatment. I understand the stress most patients undergo when I advise them to undergo injections into the eye. It is very fearful to imagine a needle going through the eye. Most of our patients are able to tolerate it well. It is very similar to any intramuscular injection. In fact, many of my patients feel it is less painful than intramuscular injections. But yes, I do understand the fear. I always tell my patients, the eye injection is less painful and less traumatizing than blindness. So ladies and gentlemen, let's take care. Self-examine your eyes periodically. Consult your eye care professional without delay. Let's prevent blindness together. Thank you.
Thank you, Dr. Mahesh. That was a very relevant message. Do not hesitate or be scared of taking treatment. Let's prevent blindness together. So far, we have seen how the optometrists or the opticians can guide us and how our doctors can help us tackle macular problems. But that's not all. Is there some way in which we ourselves can contribute? Of course, there is. Of course, there is. Lifestyle and diet are modifiable risk factors in the prevention of some macular diseases, especially age-related macular degeneration. As we shift our focus to home, we have Mr. Ryan Ong, Senior Dietitian and Nutritionist from the Khoo Teck Puat Hospital Dietetics team, who will now guide us about healthy eating. Mr. Ryan, thank you so much for joining here today. Over to you, please.
Good morning, everyone. How is everyone doing today? I hope everyone's doing fine. So first and foremost, I really would like to maybe just thank the committee for actually allowing me to actually be part of this wonderful event. And we are actually what we want to do is we really want to talk about something that we are really very passionate about, and that's really is food. So basically what happens is that for the topic that we're going to touch on is really about diet and how can we actually prevent AMD and even slow down the progression of AMD in that sense. So as our speaker has mentioned earlier on, my name is Ryan. I'm actually a senior dietitian from Khoo Teck Puat Hospital. So we're going to go straight into what is nutrition for AMD in that sense. So when we talk about diet, okay, we know that it's actually quite important when it comes down to reducing the risk of AMD and also slowing its progress. So what we actually have found that, through some of the papers that we are seeing nowadays, there are actually a lot of focus on diet and AMD. And one of the papers that we actually picked up on was actually this systematic reviewer that actually collated a lot of the studies together. And what they did was they actually picked up some of the higher quality kind of studies, and they actually had some recommendations when it comes to actually, reducing the risk of AMD and also slowing down its progress. So I'm going to share with you 4 recommendations when it comes to your diet wise. So the first one is really eating more fruits and vegetables. So if let's say if you are somebody who actually this is not your first time joining such event, you would know that actually, we have been focusing a lot on getting more fruits and vegetables. We've been telling you what is the amount that you're supposed to have and then how to incorporate a little bit more of your fruits and vegetables into your diet. But this year, we're going to go a little bit different. We're going to focus on other nutrients, okay? But having said that, it doesn't really mean that you do not take your fruits and vegetables. You still have to take it because it's still part of this nutrition when it comes down to actually your AMD diet itself. But we're going to focus a little bit more on other nutrients, which includes having a little bit more fish, having a little bit more nuts, because they are very high in your omega-3. And one very important thing is that we want to try to reduce the intake of our red and also our processed meats and also our high GI food items. So we're going to go through maybe from point 2 to point 4 in a little bit more detail. So before we actually talk about, why is it that we want to have a little bit more omega-3 fish and everything, we want to talk a little bit about the characteristics, when it comes down to your AMD diet. So surprisingly, actually, it's really not very, very different from our normal healthy eating in that sense. So the thing about the characteristics of this AMD diet is that it should be actually very high in your antioxidants. And the reason is because these antioxidants actually kind of, destroys all the free radicals that our body produces that causes the damage to our cells, including our macular cells as well. So what happens is that, if you want to actually prevent your, your cells from being damaged too quickly or actually progressing to AMD itself, having high amount of antioxidants are really very good. Okay, and then the next thing that we talk about will be basically anti-inflammatory. So what we want to do is we also want to try and reduce the inflammation that you have in terms of your vessels, your blood vessels, especially in your eyes, and also in terms of the cholesterol buildups in your eyes as well. That can actually cause AMD in the long run. So the examples of, let's say, food items that we want you to have a little bit more of would be your dark green leafy vegetables, your red and orange fruits and vegetables, your nuts, your oily fishes. These are the ones that are something that we want you to have a little bit more. And the ones that we really want you to cut down a little bit will be food items that actually causes inflammation to your arteries and to your blood vessels in that sense. So when we talk about the food items that actually causes inflammation, that will include like your red, your processed meats, your high GI food items. All this may actually worsen your AMD development and also your progression. So we're going to talk a little bit more about the omega-3 portion and also your red processed meats and also your high GI food for this time round. So, okay, as I mentioned earlier on, fruits and vegetables, they are very, very important because they are very high in your antioxidants that contains your vitamin C, your carotenoids, especially your lutein and your zeaxanthin, which are associated with reducing your AMD risk for the early stages. So it prevents you from getting AMD, and also at the same time, it actually kind of prevent you from actually progressing towards the late stages. So all these studies that we see is that, it actually focus a little bit more on the diet part as opposed to supplements. So some people will say that, hey, can I take some supplements in that sense? So actually, as I think one of the speakers has actually spoken a little bit earlier on, basically what happens is that when we talk about supplements, the studies are actually more or less quite inconclusive. Okay, so when we talk about fruits and vegetables, what is the amount of servings that we are supposed to have? We are supposed to have 2 servings of your vegetables and 2 servings of your fruits. So what is considered as 1 serving of your vegetable, that will actually equate to about 100 grams of your raw vegetables. So like your salad, or if they are talking about your cooked vegetables, that will be actually equivalent to about 3/4 mug. But the thing is, in Singapore, we don't really eat with a mug. So what we actually talk about is, or when we educate patients, we say that if you look at your plate, we want to aim for roughly around half a plate of cooked vegetables. That will be equivalent to 1 serving. Okay, or if you're going to go outside to eat, then when you talk about your economical rice store, and that will be actually ordering 2 vegetables, that will be equivalent to 1 serving in that sense. And then what about, let's say, maybe in terms of fruits, that will be considered as a feast size of an apple, orange, pear, 1 wedge of your banana, or 1 wedge of your pineapple, your watermelon, your papaya, 1 medium size of a banana, or either a handful of grapes or longan, that will be considered as 1 serving. So a lot of times people will ask me, hey, AMD diet, is there a particular vegetable or a particular fruit that I'm supposed to have? So always remember, the first important thing is that you have to make sure that you are having enough. Okay, so if you're somebody who don't really have enough vegetables, don't stress yourself out by having too many varieties. Just make sure that you have enough first. Then subsequently, you want to focus on the variety. Okay, the reason is because we don't say that there's only particular 1 vegetable for you to go for, because if you eat the same vegetables every single day, you're only going to get the antioxidant, the vitamins that is only in that vegetable. So we want you to have an array of fruits and vegetables from the different colors, so that you get the benefit of all the antioxidants that you can find in our food. Okay, so this is fruits and vegetables. We're going to move on something that is a little bit different from what we actually talk about all the time for the past couple of years. So when we talk about, let's say, in terms of omega-3, the intake of actually omega-3 from fishes was actually found to be associated with the decrease in the development of your intermediate and also your late stages of your AMD. Okay, and then the examples of your oily fishes that we actually can think of would be your salmon, your mackerel, your codfish, tuna, your trout, and also your sardine. So your fish and chip dory fish, not part of it. Okay, so the thing is, how much are we supposed to have? Okay, that is actually one question that most people would actually ask me. So when we talk about, let's say, in terms of your fishes, not only just for your AMD, but also lowering your risk of actually getting cardiovascular diseases, we want to have at least 1 serving of these oily fishes, which is roughly around that 90 grams or even that 1 palm size of your fish, for about 2 to 3 times per week. So can I have more? The answer is you can, but the thing is you still want to have variety. That's very, very important, because if you're going to eat the same type of fish every single time, you only get the vitamins from your fish. But we want you to have maybe like tofu, chicken, okay, and other sources of protein, so that you get other types of nutrients as well. Okay, so the thing is, if you look at the study that they actually show, right, is that they actually talk about your omega-3 fishes together with your intermediate and your late stages. So what about, let's say, preventing AMD? So can omega-3 actually help to prevent AMD at the early stage itself? What happens is that the study also mentioned that for the omega-3 from your fishes, it helps with the intermediate and the late stages. But the thing is that you have actually all the omega-3 sources, which is not only just your EPA, your DHA, but also your ALA itself. What it does, it can actually help to prevent the onset of AMD. Okay, and ALA is something that you don't really find in fishes, but you find many more on your plant-based food items. So for instance, like your tree nuts. So based on the paper that we actually see, they actually do recommend that we want to have nuts in our diet. And the amount that we are supposed to have is roughly about 1 handful of nuts per week. And if you find that 1 handful is really quite a lot for you to take at one sitting, what you can do is that every morning, maybe during your breakfast, you can just have maybe 2 or 3 cashew nuts, or maybe 2 or 3 walnuts in that sense, to try to incorporate a little bit more ALA into your diet. And that can actually help to actually prevent the onset of your AMD itself. Okay, so this is for omega-3. So the next thing is regarding your red and your processed meats. So this is a food group that we really want to try to cut down, not only from a point from AMD, but also from the point from your cancer prevention. Okay, so I'm sure that some of you guys would have read about, in 2018, I think end of 2018, there was a paper that actually came out and a recommendation that came out to say that, red meat and processed meats are actually causes of cancer, especially your bowel cancer. So your processed meat especially, what happens is that they are actually classified as a carcinogenic food item that is similar to smoking, but of course the degree is not that bad, okay? But for sure, we know that if you're going to have high amount of processed meat, it's going to cause cancer. And the reason why, you know, your red meat and your processed meats are actually linked to your AMD is because these carcinogenic items actually produce quite a fair bit of free radicals, and that can actually damage your macular health in the long run in that sense. So when we talk about, let's say, in terms of your processed meat, that is something that we really want to try to cut down. And the studies are actually saying that based on people who actually eat processed meats once a week versus somebody who eats once a month, the risk of you getting AMD towards the late stage is actually double. So if you're somebody who has AMD, be very careful with the amount of processed meats that you take. So the examples of your processed meats will include your ham, your bacon, your sausage, your hot dog, your salami. And for Singapore context, you see a lot of people having luncheon meat for breakfast. And that is actually part of your processed meat that we have to be very careful of, okay? So when we talk about red meat is not as bad as your processed meat itself, but basically based on what the papers are saying, they are still saying that it does still actually cause the development of your early AMD in that sense. So the examples of your red meat will include your beef, your veal, your lamb, your pork, and the portion that we are actually supposed to limit to is not that we don't want you to have, because we also understand that, you know, your beef, your veal, your lamb, your pork, they do contain very high amount of iron. Okay, which is still very important to our day-to-day life. But the thing is, what we want to do is we want to try to cut down on the reliance of red meat in our diet. And the amount that we are actually talking about is roughly around 70 grams of red meat per day, or that actually equates to roughly around 500 grams of red meat per week. So how do we actually reduce the amount of red meat? So for processed meats, our stand is, as much as possible, try to cut it down. But for red meat itself, what you can do is you can still have small amounts, but you try to actually reduce the amount of red meat that you have. And how can we actually go about reducing our red meat? So there's 4 tips in total that we're going to share with you. And the first tip is meatless Monday. Okay, so what you want to do is maybe you just want to pick one day to just go meatless as a start. So if you're somebody who actually have gone meatless already, you're cutting down your red meat, I'm not really preaching to that group. I'm preaching to the group that really are not really, are still having quite a fair bit of red meat. Okay, so then the first thing that you can do is try to pick a day to go meatless. So in KTPH, what we actually do is that for all our OT staff, where we actually provide cater food, on every single Monday, we actually do a meatless Monday for them. Okay, and then the next thing is that we can actually substitute some of our red meat, okay, or even our meat with some of our protein-based kind of protein. So let's say if I'm going to cook a curry chicken today, instead of actually using your regular portion of your chicken, what you can do is you can maybe just use half of it, and you can add in maybe half of it with your tofu in that sense. So that can actually reduce the amount of your red meat that you consume. And then also, let's say for your swapping out itself, you can try to go for, you know, recipes, you know, when you do your home cooking itself, try to go for the ones that uses more fish, more chicken rather than red meat. And last but not least, if you're somebody who doesn't really cook and you eat out very often all the time, then maybe what you want to do is maybe for that 3 meals that you have in a day, try to have only that 1 meal, okay, that is your red meat, and the rest of the meal, try to go for either your meatless option of your protein, or either you can actually go for, let's say, like a fish, your chicken as a substitute. Okay, so these are the 4 main tips that you can actually take home, you know, in terms of reducing your red meat. Then we're going to move on to the next one, which is basically to limit the high GI food items. So when we talk about GI, so what it really means is that it means that, you know, it's how fast your carbohydrate food actually digests to bring up your sugar levels that causes the spike in your sugar levels. So when we talk about GI food items that are very high, so what it means is that when I eat already, straight away my sugar levels will start to go up. Okay, and the reason why we are very scared of this spike in your sugar levels is because of the fact that, you know, when we have a lot of sugars in our blood, it causes a lot of inflammatory response by our body, and that can actually causes damage to our vessels and even to our, let's say, like our cells as well. So that's the reason why, you know, when we see the patients with diabetes, they tend to have some issues with their eye if they don't really control their sugar levels well enough. And then when we talk about the study, they are actually saying that diets that are high in your GI food items are actually associated with the increased risk of developing your early stage and also your late stages of your AMD. Okay, so one thing about your advanced stage itself, so there are also the statistics that we actually see is actually roughly around 17% risk of you actually progressing towards the late stage if you actually continuously have high amount of high GI foods and your sugar levels are actually not controlled very well. Okay, so the reason I actually mentioned earlier on is because of the hyperglycemic postprandial levels that actually causes the inflammation. So one of the things that we actually talk about is to reduce your sugar drinks, sugar beverages in your coffee, and etc. But one thing that we are actually focusing quite a fair bit is that we really want everyone to start to eat a little bit more whole grains. So not only just from a standpoint from an AMD diet prevention, but it's also because when we have higher amount of whole grains, there are a lot of studies that can actually show that we reduce the risk of diabetes. It can actually help to actually help to lose weight as well, because it gets you to feel fuller, faster, and longer, so you don't really snack a lot throughout the whole day. Okay, so the examples of your whole grains that we really want you to have a little bit more of would be your brown rice bee hoon, your wholemeal pasta, your oats, your wholemeal bread, and also your biscuits. These are just some examples of your whole grains that you can incorporate in your diet. So how can we actually try to nudge you to go for a little bit more of your whole grain items in your diet? Would be number one, similarly to your Meatless Monday, we also do have a whole grain Wednesday, where we actually encourage our patients and our staffs to actually go for more of the whole grain item. So you can pick one of the day to say that, okay, today I'm just going to go for whole grain, and try to do a step up kind of, thing. If let's say you haven't been actually eating quite a fair bit of whole grain, then you can slowly try to increase the amount and the frequency that you have. Okay, next one will be basically try to actually maybe make your breakfast as wholesome as possible. And what do I mean by it is that if you can, to make it easier, every breakfast have something that is your whole grain wholemeal. So let's say like a wholemeal bread, like a bowl of oats, that will be something that you want to look at. So we are not trying to say that you have to eat more of the whole grain, but what we want to do is we want you to substitute whatever carbohydrate that you have, which is your refined grain, like your fried rice, your fried bread, to something that is a whole grain option. Okay. And then we can try to mix your brown rice. So the minimum amount that you want to actually mix with would be 25%. And I think that is actually quite a good number for most of my patients to actually be tolerating. So there are some patients who tell me that, hey, I really cannot eat brown rice because I think it's very hard. So then what I will do is I will just tell them to start very at a low dose, but 25% is the minimum. Okay, that is because based on the studies that we are seeing, anything less than 25% really does not do any help. Okay, but basically anything that is above 25%, there's some benefits when it comes to diabetes control, or even when it comes to your weight management in that sense. Okay, and last but not least, if let's say if you're somebody who snacks, okay, instead of going for let's say like your donut, or even let's say like some of your deep fried snacks in that sense, you can go for like some of your whole grain options, which is like a popcorn. So your corn, your barley, these are all actually part of your whole grains as well. But of course, you don't want to go for the unsweetened ones. You still want to go for the you don't want to go for the sweetened ones, but you want to go for the unsweetened versions. Okay, so these are the 4 tips that we actually talk about in terms of going for more whole grains. Okay, so in terms of the recommendations that we covered, so we covered about ensuring your daily fruits and vegetables, increasing your omega-3 from your fishes and your nuts, limiting your red and your processed meats, and last but not least, okay, reducing your high GI food items. And what we actually did was we try and kind of make it easier for you to know that at which stage you really want to do okay, at which stage are you at that you really want to pick them up. Okay, so for ensuring your daily fruits and vegetables, it helps with your late stage and early stage of your wet AMD especially. And we talk about, let's say, your omega-3 fishes would be your intermediate and also your late stage. So this one will be somebody who already have AMD, and you want to slow down the progress, making sure that having adequate amount of omega-3 fishes in your diet is something that is very important. And also, let's say if you want to do some form of a prevention, having that nuts together with the fishes will be something that is actually very useful. Okay, or let's say if you're talking about your red meat and your processed meat, it can help to prevent early and also prevent the progression towards the late stage. And also for your high GI food, it's also early to the late stage. So if you look at all these recommendations that we have over here, it actually really can help people who already have AMD, or people who are actually well and actually wanting to prevent AMD in that sense. Okay, so the thing is, if you cannot remember anything from my slide, hopefully I hope you can, but if you can't, basically this is actually a summary point that I think you can take a picture of. But of course, what, with all the slides that we have over here, I appreciate if you're going to share on Facebook or any of your Instagram or anything, I really appreciate if you can maybe just put there Yishun Health, Nutrition and Dietetics, just give us a little bit of reference in that sense. Okay, so in terms of the summary of how to eat to make sure that we can prevent your AMD and also slow down the progress will be actually to really follow the healthy plate concept. So if you see HPB nowadays, the advertisement, they got the one quarter, half that one. Okay. So basically this is actually, what they're actually promoting about. So in terms of, let's say like a quarter itself, we want to really go for the whole grain items. And then also in terms of the meat, we try to opt for your fish, your nuts, and also as much as possible, try to go meatless. So we want to have like oily fishes about 2 to 3 times per week. We want to have a handful of nuts per week itself. It doesn't have to be at one sitting. We can split throughout the week itself. Or either, okay, you want to reduce your red and processed meats and also opt for meatless option. Okay, so when we talk about, when you stand at the store, economical rice store, go and think, can I have a fish, or can I have something that is meatless option instead of actually going for, let's say, like your red meat all the time. Okay, or in terms of your fruits and vegetables, we want to have 2 servings of fruits and vegetables every single day. So you want to include a variety of vegetables. But as I mentioned earlier on, if let's say you are somebody who can't even hit that 2 servings of fruits and vegetables and you're eating very little, try to work on the quantity first. Okay, and slowly try to incorporate a little bit more varieties as you go along. Okay, so this is the plate concept. So maybe if those people who want to actually take a picture, you can take a picture. We're going to leave this for maybe 1 or 2 seconds. Okay, and the last slide that we're going to talk about is actually our KTPH nutrition and dietetics tagline. So we always talk about these 3 words: quality, quantity, and frequency. So what do I mean by that? It will be basically, if I can change the quality of my diet by going for meatless, having more vegetables, going for whole grain, that is the first thing that we really want you to do. Okay, don't have to worry about the quantity first. But if you find that, today I want to eat laksa, then how? So maybe what you can do is you can try to cut down on the quantity and share that bowl with somebody else, and maybe order another dish, let's say like a soup noodles, so that you can share the meal together. Okay, and if can't, then what you do is, today I'm going to have a party and it's been a long time since I had a party because of COVID, then you try to cut down on the frequency. Okay, so how I get my patients to remember is the mother-in-law story. So the first thing is, if a son-in-law goes to the mother-in-law house to eat, you cannot tell the mother-in-law how to cook. So you cannot change the quality. So what do is you eat a little bit lesser. So you change the quantity. But if after you eat lesser, your mother-in-law not happy, then what you do is you don't go so often. Okay, but this is just a joke So I'm not asking all son-in-laws not to go to their mother-in-law's house but just have to make sure that you can remember this tagline that we have, which is quality, quantity, and frequency. So whatever that we eat, there's always something that we can change. But the first thing that we really want you to do is to change the quality of your diet first. Okay. So if you want to actually contact us, or if you want to actually know some of the reference, these are the references that we have at the bottom. And if you want the slides that are actually presented today, you can actually go to our website later on. So we'll maybe most probably share maybe in the Q&A session, or maybe I will speak to the organizer and see where can we share this information. So we have a website where we have our slides and also recipes on meatless, whole grain, and also our Instagram where we share short posts about how to improve your diet. And last but not least, we actually do have a hotline that you can call. So our hotline is actually 983-22983. Okay, so this hotline is actually mandated by our senior principal dietitian Gladys. So if you have any questions that you actually do want to ask about AMD, and even if it's not just AMD, like your diabetes control, feel free to give us a call, and we are more than happy to actually share our information and also our knowledge with you. Thank you.
Thank you, Ryan. That was a very interesting and informative talk. So far we have been talking about prevention and treatment, but what about those people whose vision has already been affected by AMD? What can we do to help them lead a better life? In our Focus at Home segment, we have with us Mr. Daniel Bohan, the senior optometrist from NUH, who deals with low vision and vision rehabilitation. And his session will throw light on what exactly we call as low vision, how it impacts daily lives, and practical strategies for living with low vision. Mr. Daniel, a warm welcome to you, and thank you for joining us today.
Thank you, Dr. Bindu, for the kind introduction, and I'd like to thank the organizing committee for inviting me this morning. I'm glad to be here. I'm actually part of the team who cares for patients with low vision, or otherwise known as visual impairment. or in layman, we call them patients who live with reduced vision. So I'll be sharing with you on what low vision is, what is the impact of low vision on everyday life, and also share some practical tips on how to work around the difficulties of living with low vision. So what is low vision? According to the World Health Organization, low vision is when vision is less than 618 or the visual field is less than 10 degrees. So meaning patients who live with tunnel vision. However, this is more on the extreme end of vision loss, or what we call moderate to severe vision impairment. From this diagram here, we know that vision is a spectrum. So we have normal vision here on the left-hand side, and then we have total blindness here on the right-hand side. So particularly for patients with AMD, they move along this spectrum. So they may start to lose vision from around 612 and slowly move along this spectrum as the disease progresses. So we adopt a more functional approach to defining low vision, and we define low vision as any vision loss that is irreversible and interferes with daily living activities. So regardless of the level of vision, so long as patients or individuals face issues with their daily living activities, we will see them and see how we could manage them. So what are the impacts of living with low vision? So a study by Taylor and his colleagues basically summarizes living with low vision living with dry AMD around three main themes, and that is diagnosis, meaning their knowledge on the nature and the eventual progression of the disease, the impact of vision loss, that is both functional and psychological, and also the coping strategies. And this revolves around the everyday issues, the practical things that they need to do on a daily basis. So these are the main visual symptoms that patients with AMD have. So they can have distorted vision. So when they look at things, things may look wavy and distorted. They can have overall blur. They can have a very large blind spot at the center, or they can have low contrast, or whatever they see, things around them, things appear faded or hazy. So we know that our world is very visual. So this is a typical visual effect of a person who has AMD in a crowded environment. And we know that because AMD affects the macula, so the visual effect concentrates on the central part of the vision, and basically the center part of the macula is where we see most clearly. So they can see some clear things at the side, but mostly the blind spot or the blurry part, the affected part, concentrates at the center. So typically, if they're in a crowded area like this, some of the issues and difficulties that they face would include reading. So when they look far ahead, it is very difficult and challenging for them to recognize and read this sign here. They have issues with face recognition. So when they look at people's and faces, it's very difficult to actually recognize details, but they say that I can recognize the body, but I can't recognize the face. They have issue with contrast. So things appear very faded. Okay, it's difficult to basically tell if there is something at the front or at the back. And as a result of low contrast, they also have issues with navigation sometimes. It's difficult when they navigate stairs and steps. So these are some of the functional effects of living with AMD. And this is Mr. Dennis Teo that recently Straits Times did a coverage on him and the issues that he faced when he visits the hawker center to have his meal. And he shared that, he can feel the tape or netting when he sweeps the chair with his hands, but, it's hard to tell when the marker is less obvious. So again, issues with contrast. So it is important to note that AMD is not just a clinical condition, but we argue that it is also a lived experience. And therefore, we take a holistic and person-centered approach when we manage low vision. And we look at ways, strategies, devices, and therapies to enhance various aspects of their daily living. So particularly in a hospital setting like NUH, there are a few specialists that would surround the patient and provide care. So we look at ways and strategies on how we can enhance their visual function, their remaining vision, making the best use of the vision that they have. We try to empower their social participation and their mobility. Some of our seniors who live with AMD are still employed, so we look at how we can support their livelihoods. We try to make their living environment more accessible. And more importantly, on a personal level, we try to honor their dignity and provide choices for them. And hopefully, overall, we try to promote health and well-being. So taking a very holistic and multiple approach in caring and managing and working around their difficulties. So here are some tips that we teach patients. And basically, we share with them these 4 principles of 4B plus S. And what is this 4B plus S? It means bigger, brighter, bolder, be organized, and use other senses. So it's very easy to remember, 4B plus S. So bigger. So there are many ways that we can make things bigger, and the easiest way is to use a simple magnifier. So there are many types of magnifiers with different variations and different levels of magnification, different power. So here you can see there are simple magnifiers that you can hold in your hand. Some comes with inbuilt lighting. There are simpler magnifiers that you just place it over your reading materials. We also have high-powered reading glasses that act as magnifiers. The other way that I teach patients is to come closer to what you are looking at. So if you look at this TV here, just by reducing the distance by half, whatever that you see straight ahead would be enlarged by twice. So basically, I tell patients something far ahead that you want to see, just half the distance, and then you can see that thing easily and clearly. Other ways to magnify things is basically physically making things bigger. So basically accessing large print materials. So there are many materials and books that are large print nowadays that are available in the library, and also large print items such as you can see over here, this large print Sudoku or even puzzle books that are available. Patients can also choose to digitally magnify things either with their smart handphones or with their smart devices like iPad and tablets, or even they can magnify things on their computer screen. So these are other ways that they can make things bigger. So the second principle is they can really benefit by making things brighter. So another tool that I would advise is a reading lamp. So whatever that they want to see or read at home, so just put on a reading lamp at the side, and that can really help to make things easier to see. And in the home environment, try to basically, set aside the curtains and open the windows and make the whole environment brighter. So another good place that I would advise patients to sit is just at the dining area and below the downlight. That is a very good area with good ambient lighting, and they can read and they can do near activities. So making things brighter. The third principle is to make things bolder. And again, there are a few ways. So instead of writing with a normal ballpoint pen, they can use a felt tip pen or a finer marker like this, when they write, so it's easier to see. On their devices, some patients benefit from using what we call a night mode or reverse mode like this. So basically making the fonts, the fonts white against a black background. And having different colored cups. So if they make black coffee, they can use a white cup, and if they make like Milo, or they make like if they drink milk or maybe some other white liquid, then they can use a black mug like this. And the other tool that I like to advise is basically getting a black table mat like this. So let's say they're organizing their pills or medication, they can just use this black table mat, and it would enhance the contrast and also make the medication bolder, because most pills are white in color. And the next principle is to be organized, to remove clutter at home. So in a drawer like this, so instead of basically trashing all their items like this, they can use an organizer. And basically things or items that they use more regularly, they can place it nearer to the handle, and things that are less used, they can put it behind. So making things easier for them. And again, in the kitchen, so instead of having a cluttered cupboard like this, they can organize this in layers like this. So being organized is another practical tip that they can adopt. And the last principle is to use other senses. So I usually reassure patients that when we start to lose our sight, our other senses begin to become better, and particularly our sense of touch and our sense of hearing, which is a neuroadaptation process. So there are other devices and ways that they can adopt to enhance their senses. So usually they say, I can't read the news. So another way would be to listen to news. So just turn on the radio, News Radio 938, or they can turn on the TV, Channel News Asia, and they can still access news by listening to it. Another way would be to use a liquid level indicator like this. So some patients say that when I make my hot drinks, I tend to overflow the hot water. So another way is to use this liquid level indicator that they can place into the mug, and then when they fill it up with hot water, and when it reaches a safe level, there will be a beeping sound. So instead of trying to see the water level, it replaces it with hearing. So this is a watch that has a very nice big and bold numbers, but it is also a talking watch. So another way would be to listen to time instead of trying to figure out the time with the vision. And also using tactile markers or bump markers like this. So this could be used on their microwave or their oven at home. So for instance, if they would like to, the buttons where they usually press to heat up their food, they can put the bump markers there. So use other sensors, maximize and optimize other sensors so that they could easily achieve their daily activities. So in summary, losing vision can be frightening. Fear is one emotion that most patients feel because of the uncertainty that they face and they encounter when confronting living with EMD. So it is helpful to adapt early and also learn about available help and resources and services. So there are available help and resources that are available in hospitals and in the community. And the first point would be to ask your eye doctor to refer you to a low vision specialist to refer you to these help and services. So thank you very much for your time and attention. Back to you, Dr. Bindu.
Yeah, thank you, Daniel. That was very informative. So as we come to the last segment of today's program, I will be elaborating about the Yishun Health Community Ophthalmology Medal Competition. So to spread awareness of macular diseases, we had reached out to the public, students, and even healthcare professionals and invited them to participate in this competition. We got a very good response, and even our healthcare colleagues surprised us with their creativity and enthusiasm. We had two categories in it. One was design it, the other was capture it. In design it, they were asked to design an AMD logo, which would be used for all our AMD collaterals. We also requested our participants to post their designs on Facebook and gather as many likes and shares as possible. In the Capture It category, the participants were asked to capture the importance of macular diseases and to share them. So they could again capture it in as a video, a poem, or artwork. The main goal was this initiative again was to create as much as awareness as possible by sharing it with friends, colleagues, and the public. The top 3 submissions in both categories would be getting a special medallion, a token of appreciation from SLR, as well as a certificate of appreciation from the YHCOM committee. So let's see who the prize winners are. And our top 3 winners in both categories have also been kind enough to share a video of what motivated them or how they came up with this creativity in the contest.
Hi everyone, my name is Preeti. I'm from the National University Health Systems. I've designed a logo for the upcoming AMD week, and I'm glad to share that it has secured the first position in the logo designing competition. So the logo itself takes the shape of an eye, and the lower lid is actually formed by the 2 carrying hands, with the central region depicted by the macula, the important area of the retina responsible for our central vision. If you look at the central circle closely, there's a grid there, which is actually the Amsler's grid, which is a very simple and effective screening tool that can detect macular pathologies quite early. I've given it a tagline called "Keep an eye on your eye," meaning we should go for regular eye screenings and check our vision regularly to detect these conditions early. Hope we can do our part in early identification and prompt treatment of this preventable cause of blindness in the future. Stay safe, everyone. Bye-bye.
Hi, my name is Christy and I'm a Year 3 student in Nanyang Technological University, NTU. My logo portrays a visual of society, represented by the hand, helping patients with macular diseases, represented by the eye, cope with the condition. A magnifying glass typically helps one to see more clearly, and my vision for the logo is for society to be the magnifying glass via spreading awareness about the condition. My motivation for submitting this logo for the competition was to use my creative skills for a good cause. Happy AMD Week!
Hello everyone, Wendy Yao from Yishun Health Eye Clinic. First of all, thanks for liking and selecting my logo design in this competition. My greatest inspiration to come out this logo design is because of my father. My father is having dry AMD in his both eye, but I'm glad that he's coping pretty well in his activity of daily living, except driving now is no longer advisable for him. For that, I hope I could understand his eye condition better by listening to him and see his world through his vision. Well, let's take a look at my logo design. This design illustrates the human eyes, and the lines inside the circle represent the retinal blood vessel in the eye. There is this great layout at both sides, which constitute the answer grade, which is a tool to detect vision problems resulting from macular-related diseases. The hearts here symbolize love and wisdom, while the cell heart icon here representing self-awareness, reminding us to take ownership for our own eyes and its well-being. For example, to participate in health promoting activity and programs such as Today AMD Awareness Week by Khoo Teck Puat Hospital and so on. That's all for the division of my logo design. Thank you once again. Stay safe and well everyone. Bye.
Hi everyone, my name is Dr. Aaron Goh and I'm a junior doctor with MOH Holdings. I also work closely with Orbis International Singapore as well as its youth-driven program, Project Orasight, to really fundraise and to raise awareness for vision loss and people living with vision impairment. Now we have created a short film featuring one of Orbis's vision ambassadors. His name is Bernard. Now Bernard has been visually impaired since 2017, but rather than succumb to self-pity or hopelessness, his is an incredible story of strength and resilience. Now, I remember him recounting to us, after losing his vision, the sense of hopelessness and despair that he was going through. But really, he was able to overcome all of that, able to rise above his circumstances and not to let his disability get the better of him. Now, hearing his story and his positive outlook on life has truly been a very humbling experience for myself. I know that patients like him will definitely influence the way that I practice medicine and the kind of doctor that I strive to be in the future. Now, we would like to thank the organisers of the Yishun Health Awareness of Macular Diseases Week and Yishun Health Community Ophthalmology Medal organisers for granting us this platform to showcase our work. If you enjoyed this film, drop us a follow on Instagram at project.orasight, at Orbis Singapore, one S in the middle, and at Orbis International. And join us in our vision to transform lives through the prevention and treatment of blindness. It is our hope that his story inspires you in the same way that it inspired us. Thank you very much for your time and kind attention, and I hope you have a great day.
Hello, my name is Faye, and I'm a fourth-year medical student from NUS. The piece that I submitted for the AMD Awareness Week is called Her Eyes, and it's a poem that showcases what it means to live with age-related macular degeneration and how the vision of those affected can be impaired. So this poem is written from the perspective of Grandpa, and it's a love poem from Grandpa to Grandma. And as the reader, you take on the persona of Grandma, who reads the poem at 2 time points, when she has AMD versus when she was young in 1968. And I hope you enjoyed reading the poem as much as I had fun writing it. Thank you so much.
Hi, hello. I'm Sophia from the Department of Dental Surgery at Khoo Teck Puat Hospital. So being a dentist, initially I was thinking about how actually visual changes could actually affect my patient's ability to brush their teeth. But of course, thinking about using that as an example for a poster, it might get a little bit too messy. So I thought of something else which just basically how macular degeneration could actually affect daily lives. So I thought about something as simple as boarding the bus. So that was actually the inspiration for the design of this poster. And I would like to thank the committee for giving us the opportunity to take part in this meaningful festival to raise awareness on macular degeneration. So, thank you.
So that was an excellent effort by all our participants. We have now come to the end of this event. We hope you have enjoyed the program this morning. We would like to remind you that there will be a sharing by Tan Tock Seng Hospital later at 11 a.m. And if you have yet to register, please scan the QR code or log into www.ktph.com.sg to register. There's also public forums offered by Ngee Ann Polytechnic and the Singapore National Eye Centre on 12th October. Last but not the least, remember to download the Mata KTPH app via the Google Play or App Store now. Thank you once again, everyone, for making this a very memorable event. Stay safe and take care.